Nowadays, everyone is condemning sugar, saying that sugar is bad, sugar is this, sugar is that evil, but they are not specific. People usually say sugar is bad. Sugar is not actually bad. Your body cannot function without that sugar. Sugar usually runs almost every system in your body, because every cell contains something that we call mitochondria. This mitochondria is a powerhouse. It's where the power and the energy is produced, and this energy comes from the breakdown of the sugar that people are condemning. Now, the sugar that is bad is the high amount, and the reason why they usually pinpoint directly to the processed sugars is because it's very easy to absorb that sugar. Once it's processed, your body will not even struggle as much to gain that sugar, meaning that you're going to have that spike very soon. Now, your body, whatever come may, this is a range where your sugar will never pass. So your body is supposed to do anything possible to maintain it at that level. This the normal range. The range, like in my population currently, is between 3.5 to 7.5 millimoles per liter. This is the normal range in my population that I am currently. We have other areas with different figures. This is something that your body will do anything to maintain, to make sure that your sugar is not going below this and your sugar is not going beyond this point. So we have mechanisms in place to make sure that this does not happen. Now, in case you have sugars that are below this, it's very dangerous, because this is hypoglycemia, and it means that your body is not having enough glucose to break down and provide energy for other processes in your body. And this is dangerous, because you might find yourself in a coma. You might find yourself in being unconscious, because you don't have enough energy to run the processes in your body. So you'll have to have enough, not much, just enough of the glucose that you are talking about here. The glucose you are talking about here is sugar. When I mention sugar, I'm talking about glucose. Now, let's go to when you have excess of this. This is called hyperglycemia. And this is where you're going to find something like diabetes mellitus. And still, a lot of sugar is pathological in you. The same case with less of that. So hypoglycemia and hyperglycemia, they are pathological. But you have more effects, and we have a lot of people suffering from a lot of sugar in your system. Because you see, evolutionary, long time ago, your body used to struggle to get that sugar from whatever you're eating. People used to do hunting and gathering, whereby your body will have to struggle so much to get that glucose from something like roots, cassavas, other meals that you're taking. So it struggled. But right now, it's very easy, because you're going to find processed sugar. And when you take that, it will be very easily absorbed into your system, leading to a spike. So your body so far has not evolved well enough to handle that high amount of sugar. So maybe we are hoping that we are going to evolve toward that direction. But because we have not, we have something that we call diabetes, which is what we are dealing with currently and struggling with. Now, let's go to diabetes, which is now the mainstay here. When it comes to sugar, most of, without talking about diabetes, we have not talked about anything. We have three types of diabetes. We have type 1 diabetes, we have type 2, and also we have gestational. Type 1, and by there, I'm sure you've heard people saying that, hey, we can reverse your diabetes. They don't know that you have several types of diabetes. When it comes to type 1, and actually before you even get to diabetes, can we get to see how your body handles sugar to make sure that it maintains this range here? Now, in case you have an increase in sugar or a drop in sugar, what does your body do to make sure that this goes back to this normal range? Now, let's start with the hormones that you have that controls this. Now, this is a very, very important organ in your body. A very, very important one called the pancreas, and we're going to focus on two cells. The first one is the beta cells that usually produce insulin, And we have the alpha cells that usually produce what we call glucagon. Insulin usually happen, or let's just first of all, because we started off by talking about hypoglycemia, let's talk about glucagon first. Now, when you have less of the sugar in your system, what happens is your pancreas, the alpha cells, will prompt your liver, because that's where we have the glycogen, to start breaking off that glycogen to produce a lot of sugar so that we can maintain the range that we are talking about here. So glucagon will be produced by the pancreas, and it will go and act on the liver and instruct that liver that, hey, you need to start producing energy, or that glucose, because we don't have a lot of that in the system. Now, let's go to, in case you have, maybe you have taken excess of the sugars, and now you have a spike in sugar. There will be production of insulin, and the pancreas will stop producing glucagon. Now, this is now insulin taking over, and the function of the insulin is to make sure that the excess of the glucose that you have here is now going back to the normal range here. Let's take, for example, you've eaten a meal and it's somewhere about 8 millimoles per liter. So this is way beyond the normal range. So you need to fix this situation here. What happens is you have the cells. There are so many in the body. Now, this insulin will instruct your cells and tell it, hey, you need to take in the sugar that you have here and start converting that to glycogen, fat cells, and so many of those, so that we get rid of this amount of sugar in the system. Now, that's what will happen. And another thing that insulin will do is it will instruct the liver now to start now making glycogen, fat cells, so that this glucose that is here is something very essential. It needs to be stored so that in case you are starving or maybe you are hungry, now your glucagon will find something to work on. So that glycogen will be as a result of now insulin instructing your liver to make more of glycogen to get rid of the sugar that you are talking about here, so that that time when it comes and you don't have the access to that sugar, you'll have something to break down to provide the same. So that's the mechanism of your body, making sure that it's controlling the amount of sugar so that you don't have excess and you don't have less of that. Up to that point, I think we're clear. Now, let's go to the types of diabetes. Now, when it comes to diabetes, it squarely falls on the insulin, because diabetes is the increase in sugar in your system, and it will be maintained for a really long time. Now, when you have this, we talked about the type 1 diabetes, type 1, type 2, and then we have gestational, which is kinda almost like type 2. They are almost the same. I like grouping them together. Type 1 is something really different, and I actually find people saying that they can reverse diabetes. What they are not telling you is it's not actually possible to reverse this effect. You can reverse this in early stages, but when it goes beyond repair, then you can only treat or maintain that using now other mechanisms which are physical, instead of now letting your body do that, because it cannot be able to handle that because the system is already broken at that point. The gestational is almost the same, but first of all, let's get to know the type 1 diabetes. When it comes to type 1 diabetes, remember we talked about the insulin being produced by the beta cells in the pancreas. So, assuming that you have a destruction in the beta cells, it means you are not going to produce insulin, or maybe you are producing less of that insulin to a point where it's not even effective at controlling the sugar. So if you have a destruction of beta cells, which is something that people actually, you can be born with a defective pancreas, so the beta cells are not functioning, or you have an autoimmune disease that leads to destruction of your beta cell, or maybe you have cancer that destroyed your beta cells, or maybe you have an accident that leads to destruction of the beta cells of your pancreas. They all lead to insufficiencies in insulin. So you don't have insulin at all, meaning that you'll have to supply that in case you want to manage this condition. You've seen those people, maybe it's a kid or someone who is very young having diabetes. 90% of the chances are they are suffering from type 1. Now, like I said earlier, you manage this condition by injecting yourself with the actual insulin. Because you don't have that, you'll have to help your body by now providing the synthetic insulin into your body. And we go now directly to the type 2. Now, type 2, this is, it's actually make the majority. This is not insulin dependent. You have a very well functioning pancreas. The beta cells are correct. They are producing insulin, which is very, very functional, but you continue overdosing yourself with that sugar. So for a long period of time, when that happens, remember we said that this insulin, when it's produced, it will go and start instructing the cells. It will start making the glucose that you have in the blood to start getting into the cells, and the mitochondria will now start acting on that to produce energy. And when that happens, now the glucose that you have will start now going down. Now, assuming that this is done, so you've taken a lot of sugar, and the insulin is like, hey, cells, I want you to take in some of the sugars that I'm sending so that we reduce that in the blood. So it does that. It will do that. And then tomorrow, the day after, then after 1 week, after 2 years, after 5 years, then after, let's say 5 years, the cell become tired of the request that it's getting all the time. So the insulin that you have here is not, it's actually even tired of doing the same thing every now and then. So you gain something that we call insulin resistance, meaning that you still have the same insulin, but it's not as functional as it used to be. So your pancreas is okay, it's producing insulin, but this insulin is not, it's tired already. It's not actually more, it's not like as functional as it used to be. It's already bored. So what ends up happening is the sugar which was being removed by that insulin instructing the cells and other mechanisms, that same sugar continue being in your blood, and that's where now you start getting that diabetes. Now, that's insulin resistance. So you take a lot of that sugar for a prolonged period of time, then you're going to end up having diabetes type 2. Now let's go to gestational. This is when a pregnant lady starts showing symptoms of increased blood sugar in their system. Now, this might be because of her status. Your body is demanding more energy because there's something growing. So it ends up making more than you require, or you end up eating more than you require. So you expose yourself, your body, with a lot of that sugar. And when that happens for a prolonged period of time, it's going to graduate to type 2. When this is not managed during that pregnancy, and this is why I usually tell my patients, when you're pregnant, always make sure that you go for screening. So you're screened for this glucose, whether your body is able to handle that glucose well enough. It's good to just go get a simple test like random blood sugar. Just once in a while, you just go get tested so that you get a check of this, because if you don't manage this when it's still early, it's going to graduate to type 2, such that even if you give birth, you're still going to continue with your diabetes. Now, those are the 3 types of diabetes that we've talked about. Now, how do we test them? We have several ways we usually do, and we're going to focus on 4. The first one is RBS, random blood sugar. This is a test. This is the first one. The second one is FBS. This is fasting blood sugar. We have the third one called oral glucose tolerance test, or GTT. Now we have another one called HbA1c. Now they all focus on sugars, but they measure that sugar differently. Apart from this, okay, they all measure almost the same thing. This measures something a little bit different, but all related to the sugars. Let's get to start with the simplest of all. This is the random blood sugar. You just go to a hospital, you get tested whether you have sugars being above normal. Remember I said in my population is 3.5 to 7.5. Yours might be different, millimoles per liter. You go to a hospital, a machine like this one, you see a machine like this one, this is a glucometer. They prick you, and then this machine will check how much of the glucose you have in your system. In case it's higher than this, then you are hyperglycemic. And they are going to repeat this test severally. And if you're still showing up with the same symptoms, then they are going to instruct you into now the second test. It's called fasting blood sugar. Now, this one is slightly interesting because now you'll have to fast for at least 12 hours. Now, we usually recommend 8 hours, but 12 is quite okay. What you do is, let's take, for example, you want to do this test tomorrow. So, 6 p.m. today will be the last time that you'll be taking a meal. So, you don't take anything from 6 p.m. to 6 a.m. or up to the time that you're going to see your doctor. So, this, you're only allowed to take water and nothing food. You just make sure that you don't take any food. You just go on an empty stomach, and then they take your FBS. I'm going to put some normal ranges here for the FBS. This is the fasting blood sugar. In case it's high, this is pointing toward diabetes or pre-diabetes. Now, let's go to the next one. In case maybe they discover, this person is still showing up symptoms of that are not so much conclusive on diabetes mellitus, let's first of all do another test and try to see how their body can be able to handle that. This is the test that I've said called OGTT, oral glucose tolerance test. What you're going to do for the preparation is you're also going to do exactly what we did here. You're going to fast for this period of time for at least 12 hours. I usually say at least 8 hours, but I prefer 12. Now, after that, then you go to a hospital, and then you find that qualified person there waiting for you. They are going to give you 75 grams of sugar. 75 grams of glucose. This is the simplest form. It means that this will start being absorbed right from the stomach. Now, because it is in the simplest form, so they are going to give you 75 grams of sugar. So they are going to dissolve this glucose in a cup of water, and then you take that. But before you take that, they are going to take that blood sugar. They are going to test. So that will be test 1. So they check the amount of sugar that you have at that point. And then after you take that glass that you have there, then they are going to give you 2 hours. So you're going to stay there for 2 hours, and after every 30 minutes, mostly sometimes you might find that they're taking measurement after 1 hour, then after the other hour, and then they draw that graph. But I prefer after every 30 minutes. After 30 minutes, they take a reading. Another this will be now test 2, then test 3. Test 4 after every 30 minutes all the way up to 2 hours. Now, after they have now the values with them, they are going to draw a graph, and this will be now the concentration in millimoles or whatever units you are using to measure that glucose. So this will be the glucose concentration in the blood, and this will be time. Maybe this was time 0. This is 30 minutes. This is 60, which means it's 1 hour. This is 1 hour, 30 minutes. This is 2 hours. And then they are going to draw the curve. Now, a normal curve should look like this. Take, for example, you are at around between 3.5. Let's say you are 5 millimoles per liter. So your 5 was here. This is 10. Let's say this is 15 all the way up. So this is 5. Your sugar was here. So your curve will go this, because you've taken that glucose. It's going to rise in your blood, rise, and then if you have a functional system, this sugar will start being controlled, and it will start falling and go back to the previous point. It will go and become now normal and continue being that. So this is a normal curve. When it comes to those with a okay, I'm not going to delete that. Let me just use another pen. Now, in case it's your system is defective, you might find that yes, it was actually going like that, very normal. But when it comes to this point, instead of going down, it will just flatten out and it will continue being in your system for a prolonged period of time. This is where I usually tell people, in case you have a person like this, you are testing for OGTT, always make sure you have a good access to a clinic or a physician, whereby in case this sugar becomes problematic because you have introduced this sugar in them, this sugar can be managed, because you might find other people who cannot be able to manage this sugar. Now, when your curve looks like this, it means that you have issues with your system. Your body is not responding to the sugar. So you are either having a defective insulin or you have insulin resistance. So that was on OGTT. Let's go to a very, very interesting one, which is kind of more conclusive, called HbA1c. This is called glycated hemoglobin. Glycated hemoglobin. We talked about hemoglobin when we were talking about the red blood cells. So the red blood cells contain hemoglobin. Now, the basis of this test is, you see, your red blood cells, the lifespan is between 90 to 120 days. So after 90 to 120 days, your cells will be recycled. They will be destroyed and new ones will be formed. Now, what we are going to do is we are going to check for the HB that has interacted with the sugar, and this will be more interesting, because now, because the lifespan of our cell, the least will be 90 days, it means that we are measuring the amount of sugar that has interacted with this cell for a period of 3 months. So that will give you some very good indications. Now, HbA1c is given in percentages. We have normal, which is always below 5%, and then we have pre-diabetic, which is between 5 to 6. This is pre-diabetic percent, and then we have diabetic, anything above 6. So if you're above 6%, then you're diabetic. So we have another very, very important test, which is not related to blood now. This is now in the urine. When you go for a test that we call urinalysis, your urine is measured by a something strip that looks like almost like this. It has several pads. It has a pad that looks for ketones, another one that looks for bilirubin, another one looking for different things. When you flood this with urine, then we have a patch that will look for glucose. In case you have this glucose in your urine, it means that a renal threshold was reached. And when you get glucose in your urine, it means you have more of that sugar in your system, such that your renal threshold was exceeded, and now your body was like, hey, we have a lot of sugar in your blood, now we need to get rid of the excess through the urine. So this is where you're now going to get glucose. So when you get glucose in urine, then you should go to the blood to check whether it's actually a diabetic person or maybe someone who is struggling with sugar. So urinalysis can also help in that. We also have other tests that still check for the glucose in urine, but this is one of the most common ones and one which is easily accessible. I'm sure you have learned something. Now, I want you to tell me several things. One, for those who are not diabetic at all, what are you doing to make sure that you don't get diabetic? For those who are pre-diabetic, what are you doing to make sure that this situation does not graduate to now being fully diabetic? And for those who are diabetic already, what are you doing to make sure that the pathological effect of the sugar does not affect your daily lives? Let's continue this conversation down there in the comment region.